Strategy number 3, evidence-based learning. Interleaving is another evidence-based learning concept. The idea is that as you're learning information, sometimes you have to double back on information you've learned in the past in order to apply it in the future. So for example, maybe you've been learning about fluid and electrolytes, and then next week you begin learning about different conditions where you see fluid and electrolyte imbalance. It would be very appropriate to circle back to some of the discussions that you had a week or 2 weeks before, or maybe even a semester before when you were learning about signs and symptoms. It would be very appropriate to circle back and look at old information before going on to newer information. And so the idea with interleaving is you're taking 2 or 3 steps forward in your learning, but then you're stepping back to review before you go forward. That deepens the learning, enhances the memory, and will help you to be able to recall it later. Connection. Connection is so important to learning. Connection is a way that your brain makes sense of the information that you're learning. And so when you learn something new, maybe you learn a fact, maybe you learn about what a normal vital sign is. If your brain has no context for that, it makes it very difficult for you to remember. But instead, if you learned what a normal blood pressure was, for example, you practiced it in a lab, maybe you we're thinking about a grandparent that you have that has high blood pressure. So now your brain is making multiple connections to this idea of blood pressure and what normal and abnormal is. And that makes it much easier for your brain to recall. And so the more points of connection you have, the stronger that memory recall is. And what we know is that emotion is the strongest. So when you laugh at something, cry at something, hear a story about a patient, those are going to be the ones that you're most likely to remember. And so as you're learning, think about that. How have I seen this before? How have I heard this information before? What is a story that I can think of that would help me remember it? All of that is an important part of learning.
For real world answers to all of your questions on nursing school.